Faith Thomas Foundation would like to thank you for listening to The Cell. We broadcast on WGRN 94.1 FM every Wednesday night at 7:30 p.m. You can also stream us live on Wednesdays at 7:30 p.m. on WGRN 94.1. For more information on the Faith Thomas Foundation, please visit our website, Facebook, and follow us on Twitter. Our Twitter handle is Faith Thomas FDN.
I'd like to welcome our listeners back. Boy, is it cold outside, and I hope that everyone is staying bundled up and being safe. Please don't forget also to be COVID safe. Wear a mask, wash your hands, and stay 6 feet apart. We are not only dealing with the pandemic, but we also need to recognize and be aware of the fact that we may have or know family members and friends who are dealing with depression, anxiety, and even thoughts of suicide, especially with the unexpected changes that have taken place in everyone's life over the past year, and especially with the upcoming holidays. Those are two important holidays for everyone. And with all the changes that have taken place, a lot of people are going to be, feeling a certain way because they're not going to be able to celebrate it the way that they have in the past. So with us today, we have Columbus Public Health, Marian Stuckey. She is Section Chief of the City of Columbus Neighborhood Social Services. Hello, Marian.
Hi, Felice. Hi, everyone.
So I also have with me my partner in crime, Mr. Ernest Kelly. Hello, Ernie.
Hello, Marian.
And Mr. Stephanie Thomas. Miss Stephanie Thomas. How you doing, Stephanie?
Hello, everyone, and welcome to the show, Marian.
Marian, what I'd like to start out with is you letting our listeners know a little bit about yourself. How did you end up coming to the current position that you're in right now at the Columbus Public Health Department?
Yes, that's a great question. So my journey to my current job is honestly all over the place. I started out doing actually benefits at Job and Family Services and realized that just having to take benefits away from people and I didn't necessarily know their circumstances was not something that I wanted to do for the long haul. And so from there, I ended up going back to school and got my master's in social work and then started working in positions where I had the opportunity to work with people side by side. I felt like a partnership in their lives. And so that kind of foundation has really set the tone for me in my professional career. Just being able to be, for example, I started off as a case manager after college. And for those who don't know, that's really someone, again, who is working alongside another person, helping them overcome barriers. And that could be mental health barriers. It could be just kind of environmental things. It can be issues of poverty, just really kind of seeing what it's like from someone's perspective. And I think that, again, just trying to walk them out in someone else's shoes is something that really helps us to see what it's like to be in someone else's position. And I really saw that firsthand. I then went on to do some work in education and then transitioned to my work in public health. Started off doing health insurance enrollment. Again, just understanding the importance of access to not only physical health but behavioral health needs. And so being able to just maximize health insurance options for Columbus residents was my focus in that position. And then I transitioned to the role, my current role, which is around neighborhood-based needs, social needs, behavioral health needs, physical health needs. And then here lately, I've worked on a big program, I would say, called the Columbus Care Coalition, which focuses on community trauma. So really looking at things that happen in the community, such as homicides or shootings, fires, just large-scale things that have a really hard impact on the community. And, again, bringing services to people to show them that we are here and that we care and, that they don't have to go about things alone. So that's kind of how I came into where I am currently, and I absolutely love the work that I do.
Okay, so you're a giver.
I love to give.
Tell us about the Care Coalition.
So the Care Coalition works with families, and that includes children and includes across the lifespan. It's amazing work in the sense that when trauma happens to someone, and what I mean by trauma is it's just when our ability to cope with something is overwhelmed, it can put us in a state of a trauma. And basically everybody's threshold for trauma and resilience is different. But when we're able to respond to, families, we're able to give them some resources, some support. We're able to just go out and say, hey, like, we know that you've been through a really difficult time, and we're here to help. We're here to help, and we really center around the person and the family and to ask them what their needs are. It's not about pressuring people to do anything, but more or less just helping them navigate during a really stressful time where everything is mostly overwhelming and they're having to make a lot of decisions, and it can be really difficult. So just really giving them the space to know that, again, that there are people there that care and want to support them. And so that's care. And again, we work with, it just depends on what happened. So that sometimes we work with families after the loss of a child, for example. And it's very much so related to gun violence most of the time, but sometimes there's other things that come up. Car crashes was one, for example. There's a variety of different things. But oftentimes we're called out to gun violence, and it's tragic, the different situations that we're responding to, but also just, again, being that little light of hope during a very dark time for many families.
Marian, you guys seem to be real busy this year with a lot of the things going on in the community and stuff like that. So when, like one of the kids shot his brother, will you guys be called out for something like that?
Yes. Mm-hmm.
So it wouldn't be you yourself. It'd be your staff. How many employees or people work with you in your area?
Yeah. So the beauty of our work is I have a staff that's employed at Columbus Public Health of 6 people. So there's 6 people that work directly under me, and that includes outreach workers and social workers. But we also have a whole coalition, and a coalition of mental health professionals, community members. We have a specialized team called the Community Trauma Resource Team, and that is individuals who are trained in crisis intervention and psychological first aid that we can call on, too, to help us in certain situations. So we're really fortunate to have the support of so many different community partners that help make it possible for us to, like, for example, we do during normal times outside of the pandemic, for example, we would do door-to-door outreach in about a 2-block radius around where the incident occurred. And so we really call on our partners to help us, boots on the ground, bringing our services to the community, for example. But, yeah, that's one example of how we are able to mobilize not only staff but also community members. And we're always welcoming new people to come and join our effort as well.
I had another question. This is probably just a policy question because, all the talk about having social services go into neighborhoods with police officers. I was wondering, Marian, if you could speak to that. Have you guys had any kind of discussion down there at City Hall about that happening or not happening?
I can tell you very preliminarily that there is discussions on hiring social workers to be part of outreach teams. And so, unfortunately, I can't speak a lot to that because I'm not necessarily in those conversations, but I know that here recently there's been a lot of conversation around how can we mobilize social workers and those who are trained to deal with mental health crisis and even socioeconomic things that are happening that are causing problems, so like root cause issues instead of just the things that are presenting. So I know that is definitely a conversation. I'm too kind of waiting to see where that'll land, if and how my team can be a support to that. Because honestly, the model that we do is kind of similar to that in terms of responding after a crisis and kind of helping with the emotional aspects of people dealing with a crisis. And so I can say, yes, I know that it's in the works, but I don't have all the full details on all the ins and outs. But I know that is definitely a priority of our city leadership.
Okay, thank you.
In regards to, I know that you have your community outreach, and you said that you look for volunteers. What is it that you're looking for in your volunteers, and do you require special type of certifications or degrees behind it?
Yeah, so we actually are pretty open with our volunteers. It's really a time commitment, and that's really kind of the hard part is just making sure people are aware that we do ask you to do a certain number of outreaches each year. We ask you to help us respond to crisis. We have a debriefing model that we use. It's actually called NOVA, which stands for the National Organization of Victims Assistance. And so we actually put our volunteers through a 3-day training so they are able to respond. But in terms of, and that becomes a certificate, I would say. So our goal is to open it up to the community and to have those who are living in communities where, trauma is happening to help us be that, that lived experience, that voice. And we want to make sure that we offer it to, pretty far and wide to people to be able to embark on the training opportunity. So you don't necessarily have to be a social worker or a counselor already, but just, I would say, having a heart for people. You talked about giving earlier, just wanting to give back to communities that have seen a lot of pain and suffering, and the time commitment to be able to respond and to be able to, help us out. It's not like it happens instantaneously. We usually have a couple of days notice, and there's some planning that goes in. So it's not like it's we need a quick turnaround per se, but it is a couple of day turnaround time. So just allowing people to, check with their schedules and create some space for us to do outreach within their workday or within their day is really our biggest ask.
If you guys excuse me for a minute, we need to take an identification break.
Hi, this is Ernest Kelly with the Faith Thomas Foundation. You're listening to The Cell on 94.1 FM, WGRN, and WGRN.org worldwide. Listen to us every Wednesday night at 7:30 p.m.
I have a question. Obviously, with COVID, I feel like mental health has been something that not only we've been able to raise awareness, but it has definitely impacted people's mental health, just due to being affected for loss, just the experience in general. How has COVID impacted you guys and the services that you guys provide? Have you guys hired new people just to specifically focus on those that have been impacted by COVID? Has your workload went up? How has COVID impacted your services?
Yeah, COVID definitely came and changed pretty much everything. So for us, it changed how we were able to do outreach. We had to scale back on our door-to-door outreach just for the safety of everyone involved. And we've tried to monitor when cases where we are as a city with cases to see how we could go back out again, because one of the things that we really value, again, is bringing our services to the community. And so to not be able to do that felt like it felt like a loss, right? To not be able to, for example, say a homicide happened and then we couldn't do our direct engagement with the community, felt like we were not able to kind of fulfill our mission. So we were all trying to figure out how we could best do it. We kind of found different ways of kind of just doing maybe more of a late drop instead of, actually, and it's another thing too to knock on someone's door and expect residents to, want to engage with someone that they don't necessarily know and don't know their status, So it's important that we created some space. And so one of the things we did was do more lit drops, and at this time we're just doing mailers, which we know we're trying to work through, again, the nuances of the pandemic. So that's one way it affected us kind of on the negative end. But I would say we continue to do what we call next of kin contacts. And that's, we call the families directly. So we kind of work in circles. So we work for the first circle is those who are most closely impacted by the situation. So we still are able to connect with those families directly. And this year we've been able to really implement a grief basket delivery. So that's something we're really proud of, to be able to just give a little bit of comfort, just a little bit. We know it's not a lot, but it's a little something during a time of grief to the family. So we're able to hand deliver a grief basket to those families. And we're able to just kind of get the word out about our services still being available, do anything like virtual debriefings, that kind of thing. But sure, you're right. It's definitely been difficult, especially for the way we deliver our services, to try to figure out the best way to reach people during the pandemic. I will also say, we've talked a lot about this, but there's if you kind of can envision like the wave of the pandemic, and then on top of that is a bigger wave, and that's like the mental health aspect of everyone dealing with the pandemic. So one thing we've also tried to focus on as a coalition is just really being honest about and upfront about the implications of the pandemic and how it's really been an extremely difficult time for people, not only because of job loss and financial insecurity, but also just isolation and just not being able to connect with family. We're social beings, and relationships are healing, and so it's really hard when we can't have that, that human touch in those times with family. So it's really been something that it's hard to see when people are distant and not able to connect in the same ways. So we've really tried to work on providing as much education as we can about mental health and about like what are the signs to look for, and like finding different ways to connect. We call it kind of replacement behavior. So what are some of the other things, what are the other ways that you can connect in these times? I know we see a lot of the Zoom meetings and just connecting through different ways, maybe making sure you're social distancing and all that, but kind of almost reframing it. It's a little bit less of it. So we're still able to be social, but we're just not able to be physically close as we were. So kind of reframing the social distancing to maybe like the physical distancing. So we can still maintain social contact, but just in different ways. But it's really been tough, and just to see how the pandemic has really changed many people, the majority of the way people do business, but also the resilience and the creativity that's come up as a result has been really great to see. So that's really what I would say around how we've had to maneuver. Of course, CPH as a whole, our whole structure is different right now because of the pandemic. So that's a whole other thing. But for my program specifically, it's just been about trying to find more creative ways of reaching out to maintain safety, but also to maintain that social connection.
Awesome. Well, thank you very much for explaining that.
I would like to ask about your community trauma response team. Could you give us an example, like if you received a phone call about a trauma? Because I know like we're dealing with COVID-19, and when you're dealing with that type of situation in their family, I know it's hard to not want to necessarily be close, or, you want to be more intimate with that situation. Can you kind of, like walk us through, like you just received a phone call that there was, I think like Ernie gave one, the young man being shot. Can you walk us through what your community response team would do?
Absolutely. So say we got notification that, there's been a loss in the community. What we do, our first point of contact is always the family. We always want to start there and work our way from there. And so we'll do all we can to reach the family, to check in with them. It's such an overwhelming time, especially if it's like the loss of a loved one. So just being able to like maneuver all the different decisions that are being thrown at them all at once. You have the funeral, you have understanding what happened, you have the sadness, the grief, and the shock, all kind of balled up into one. And so what we hear time and time again is that the families are just so overwhelmed and not quite sure where to start. And so they also interestingly, they also talk a lot about just how insensitive people can be in the process. And so we really we do just kind of a sidebar. We do focus groups too with families to kind of really learn about what their experience was, because we find it really important as service professionals to be able to get that real-time feedback about what families are facing and how we can improve and how we can do things differently and better. And so a lot of the information we've heard, again, is just that there's so much being thrown at the families all at once, and even honestly sometimes like trying to fit in another call is difficult. So we keep that in mind too. But we do, as soon as we hear about the loss, we do try to reach out and see if we can connect them sometimes with like victims of crime, for example, depending on the nature of the loss. If it was a violent loss, there's some resources that could be helpful. But also just checking in with them seeing if they need resources for the funeral and burial. So there's several things here in Columbus that are available to help families. So we have some listings of things to help families with that piece. Also, eventually, and maybe this is not always at the that first call, we have a system where we call every about 3 months or so, because again, we know that sometimes in the midst of everything that's going on, it's not the most appropriate time to talk about connection to therapy at that time. It's really just them trying to figure out what they need to do minute by minute. And so we also, in the initial part of our interaction with the family, will work on again, those immediate connections with needs, burial information. We try to get the grief basket out to them as soon as we can, if possible. And then from there, we kind of circle back a few months later to check in and see how they're doing. And it's generally at that time that we work to connect them with some ongoing support around like mental health therapy. We're able to kind of help process through with them. If they have other children in the home or family members that are really struggling, just kind of planning how to best get the family supported. And so that's our kind of step one. Step one is the family, those closely impacted by the situation. And then the second part for us is the community. So again, we kind of map out that 2 to 3 block radius of where it happened. And during times that we can, we've done direct door-to-door outreach. So we'll bring some of our material, and that includes like how do you cope after a community loss, or how do you cope with community violence. We find that just having information is important, and the more we can kind of talk to people about that, I'm not sure, you never know how much people are reading after you give them the information, but the more you can kind of just say, hey, like, my name's Marian, I'm here with the CARE Coalition, are you okay? Like, it's generally just as simple as that. And people will choose to open up if they have time to and are willing to. Oftentimes people do want to talk. I'll never forget one of our first times going out. We had a man who had recently moved from California, I believe, and he shared with us that, he had just moved to this neighborhood and he thought he was doing something that really helped his family. And then, homicide happened a few doors down, and it was really hard for him to accept. His sense of safety was really jeopardized, as well as his family, and that heaviness of the loss of life that happened just a couple of doors down. So it's amazing. And I always say when you open the door, people will come and they'll tell you their experiences, and they'll share with you, things that they might be holding on to. And so, as a mental health professional myself and a therapist, I see every day the value in just having that person or that support system that you can really talk to and you can really open up to. We all need that. We all need that person that we can just talk to and not feel judged, but to feel 100% safe, and you can just kind of just breathe out, just let it all out, and just know that it's going to land in a safe place with someone who cares about your well-being and just wants you to be okay. So we've kind of tried to replicate that on a community version or a community scale. But also knowing, too, one thing I've observed is just the low mental health utilization overall sometimes in communities of color. And so it's really important for us, too, to kind of start to build rapport and to say, like, yeah, I'm a social worker and I'm here to help, and this is what we do, to kind of start building that bridge. So, again, to kind of get back to what I was sharing, the second part would be community outreach. And then kind of connecting the community members to resources as needed. Another quick example is one of the first times that we went out, it was around Thanksgiving time. So being able to share Thanksgiving, meal giveaways and just different things that were going on was also helpful. So just being helpful, just, again, being a giver. I love, Ms. Felisa, as you said, being a giver. Like, what does it look like to be a giver, all the time in communities of need? And this is really something that we really strive to do overall. Another thing, I would say kind of like the third circle or the third thing that we do as needed would be called a community debriefing. And so let's say something recently happened and, there's community members who are just kind of reeling from the loss and shocked because, whenever we're faced with a situation that we weren't necessarily prepared for, we have to understand that there's emotional reactions to that. And part of that is shock and disbelief and deep depression sometimes, and just, sadness, grief. And so a debriefing is actually bringing people together and just holding space to talk about things, to kind of really get those feelings out and to be validated by those in the room who have similar experiences and were also affected by whatever the situation was. But then also, again, our follow-up is always to help people get connected to resources at the end. So that's kind of our three-stage process as we think about the community trauma resource team and the work that we do.
Yeah, Marian, just listening to that sounds pretty intensive as far as outreach and connecting. But I keep thinking about the budget. How is that going to impact your budget this year with COVID for the upcoming year?
So right now, I'm not aware of any budgetary cuts or anything. So what my program is going to be operating as is, as far as I'm aware of. I know that there's been, other things that, that may not be operating in the same capacity, but the Care Coalition and our neighborhood social work program is very fortunate to be able to operate without any cuts or any issues based on the pandemic. So we're still okay, and as soon as we can safely get back out, we will definitely be back out in the community.
Excuse me, but our time has run out. You just listened to part 1 of Columbus Public Health with Marian Stuckey talking about the Columbus Care Coalition and the type of services they provide within our community on behalf of the City of Columbus. To learn more about the Columbus Care Coalition, you can log on to the City of Columbus Public Health Department's website. You can also email them at health@columbus.gov and call them at 614-645-6807. So, I hope you tune in next Wednesday for part 2. This is Felice. Peace out. The Faith Thomas Foundation would like to thank you for listening to The Cell. We broadcast on WGRN 94.1 FM every Wednesday night at 7:30 p.m. You can also stream us live on Wednesdays at 7:30 p.m. on WGRN 94.1. For more information on the Faith Thomas Foundation, please visit our website, Facebook, and follow us on Twitter. Our Twitter handle is Faith Thomas FDN.